Some diseases strike like lightning, fast, brutal, and unmistakable. Imagine going to bed tonight and never truly waking up again. Not death, something far worse than that. You open your eyes in the morning, but your body has already forgotten how to swallow. Your legs, which carried you just fine yesterday, now refuse to cooperate. And the strangest part? Every single night, while you sleep, your own immune system, the thing that's supposed to protect you, is quietly, methodically, destroying your brain. This isn't a horror film. This is anti-Iglon 5 disease, and it has been described by neurologists as one of the most bizarre, most terrifying conditions ever documented in medical history. Today, I want to tell you the story of a man I'll call Thomas, a 61-year-old from Denmark. His case is based on a real, documented medical report, though I've given him the name Thomas to make the story easier to follow. The key clinical details are true to the published case, but I've shaped the narrative to help you feel what this terrifying condition is really like. Meet Thomas, a retired schoolteacher from Denmark. 61 years old, sharp mind, active life. The kind of man who spent his weekends hiking and his evenings reading. It started with something almost laughable: sleep problems. He'd wake up at 3 a.m., arms flailing, making strange, repetitive movements he couldn't explain or even remember. His wife described it as watching someone conduct an invisible orchestra, in absolute silence, night after night. Then came the mornings, a slight wobble in his step, food going down the wrong way at dinner, words catching in his throat mid-sentence, as if his brain sent the signal, but his mouth simply forgot what to do with it. His doctors, they were baffled. Parkinson's was ruled out. ALS was ruled out. Dementia was ruled out. For months, then years, Thomas was passed from specialist to specialist, collecting misdiagnoses like postcards, while his body quietly collapsed around him. Here's what was actually happening inside Thomas's body, and I want you to really picture this. Deep in your brain, there's a protein called Iglon 5. Think of it as a kind of cellular glue. It helps your nerve cells connect, communicate, hold themselves together. It's especially critical in the regions that control sleep, movement, and swallowing. For reasons science still doesn't fully understand, some people's immune systems make a catastrophic mistake. They look at Iglon 5 and decide it's the enemy. They produce antibodies, weapons, specifically designed to destroy it. And here's where it gets truly dark. As those antibodies tear the protein apart, the damage triggers something else, the buildup of a toxic protein called tau. You've heard of tau before. It's the same protein that accumulates in Alzheimer's disease. It clogs neurons, kills them, and the brain begins to shrink from within. So you have the immune system attacking from one side and tau poisoning the neurons from the other. A two-front war inside your own skull, and you're losing it in your sleep. This disease didn't even have a name until 2014. That year, Dr. Lydia Sabater and her colleagues at the hospital clinic in Barcelona published a landmark paper in The Lancet Neurology. They had identified 8 patients, all presenting with this strange, chaotic combination of sleep disorders, swallowing difficulties, and gait problems. All of them had antibodies targeting the same protein, Iglon 5. It was the first time anyone had ever seen this. A disease sitting right at the intersection of autoimmunity and neurodegeneration, a place doctors didn't even think was possible. Dr. Carles Geig, a neurologist in the same Barcelona team, later expanded the research. By 2017, he and his colleagues had documented the full clinical picture. They found that around 83% of patients had severe sleep disturbances. More than 60% developed gait instability and difficulty swallowing. Half showed signs of cognitive decline. And in some, the deterioration was so rapid, so severe, that death came suddenly. Sometimes in the night, without warning, 1 in 150,000 people. That's roughly how rare this is. And yet, given how recently it was discovered, researchers believe thousands of cases have gone undiagnosed for decades, labeled as Parkinson's, as ALS, as dementia, when the real culprit was hiding in the blood all along. Thomas's diagnosis finally came after 11 years. 11 years of wrong answers. A neurologist in Copenhagen, following new diagnostic guidelines developed in part by Gage's team, ordered a very specific blood test, one that most hospitals weren't even routinely running. The results came back positive for IGLON-5 antibodies. Think about what that moment feels like. 11 years of being told nothing is wrong, or that it's something untreatable, or that it's all in your head, and then, finally, a name. A real, verifiable, biological explanation. But here's the brutal truth that Thomas also had to hear. There is no cure. What doctors could offer Thomas, what they offer all anti-IGLON-5 patients, is immunotherapy. The goal is simple in theory: calm the immune system down before it causes more damage. His doctors started with high-dose corticosteroids, essentially powerful anti-inflammatory drugs that try to suppress the antibody attack. When that wasn't enough alone, they added intravenous immunoglobulin, IVIG, a treatment where antibodies from healthy donors are infused into the patient to essentially dilute the harmful ones. Later, a drug called rituximab was introduced, a targeted therapy that wipes out the specific immune cells producing the rogue antibodies. Did it work? Partially. His sleep stabilized, some of the movement issues improved, but the damage already done, the tau already deposited, the neurons already lost, that doesn't reverse. The doctors were fighting a war where the battlefield had already been partially destroyed. Dr. Thomas Grüter, a German neurologist whose 2022 study became a turning point in understanding treatment outcomes, found something crucial. Patients who started immunotherapy within 6 weeks of significant deterioration had measurably better outcomes. Early action matters, but anti-IGLON-5 is so rarely recognized, so often mistaken for something else, that those 6 weeks almost never happen. Thomas is still alive. He lives with the consequences of 11 years of unchecked damage. He uses a walker now. Meals require careful planning. But he is alive, and after more than a decade of not knowing what was happening to him, he says that knowing is its own kind of relief. There are patients who weren't as lucky. Sudden death during sleep is documented in roughly a third of anti-IGLON-5 cases. Not from an obvious cause, no heart attack, no stroke, just silence. The brainstem, overwhelmed, simply stops. And I want you to sit with that for a moment, because somewhere out there, right now, there are people going from doctor to doctor, being told their sleep problems are stress, their wobble is aging, their memory slips are normal. And some of them have this, and they don't know it. Anti-IGLON-5 disease is a reminder that the human body can turn against itself in ways we are only beginning to understand. That the brain, the most complex structure in the known universe, can become the site of a war it didn't choose and may not survive. And the only weapon we currently have is knowing it exists. If you want to see more stories like this, the ones medicine is still trying to figure out, you know where to find us. Drop a comment below. Tell us what condition you want to understand next. We read every single one.